can be made to get up.
Yeah.
It's not going to have to paralyse and train him again.
Going to help you with a little bit of a shake. Stay focused and clear some of that stuff off your lungs.
Lucas is massaging his patient's lungs.
Good man.
He's a physiotherapist in intensive care. We're at the Royal Free in London, where 84 of the 90 patients here are on ventilators.
There's just so many people to be seen, and as soon as one person leaves, there seems to just be someone comes straight back in. Staff-wise, we're stretched. We're working probably the hardest we're ever going to work in our careers.
Day 11, but he's got a good old amount of time to be on a ventilator. We've got all ages and sizes, variety of backgrounds, of social backgrounds, medical backgrounds.
In fact, most here today are in their 50s. The consultant also tells me it's not the volume of patients that's the concern, but staff.
There are no more intensive care nurses to be found. We don't have a secret supply of them. We simply have to use the nurses we've got. There is no cavalry. This is what we have to endeavour to do.
Nurses usually look after one patient. Today they have 4, and NEASSA is usually a paediatric occupational therapist.
We wouldn't normally be here. It's a completely different environment than we work in, but I think with the pressure and everything that's going on, they just need extra helping hands.
You can perhaps have a discussion almost face to face and explain how precarious things are.
Whilst we were there, things were not looking good for one of Dr. Ward's patients. He had to update the family on the phone. Such conversations are now sadly routine.
We've seen pictures like this from inside intensive care since last March. Patient after patient lined up on ventilators. But doctors here do not want people to become immune to this sight. This is not normal. It's horrific for patients and for staff.
Good man.
None of the patients was well enough to speak to us. They are all on new treatment, steroids, anti-inflammatories and antibiotics. It means pharmacists too are finding it hard to keep up with demand.
Where there's a bay of 2, you've got 3 patients in there, it just makes it a bit more manic. And in terms of a supply thing, trying to get the medications that people need, it's just vast quantities that we're going through. I've never seen anything like this before, if I'm being completely honest.
Given that you're at 90 patients now, though, is the worry that you're going to have to make more difficult decisions about whether to admit someone here or not?
I think it's very much a doomsday scenario, and I don't think we're there at this point. At the moment, if you need an intensive care bed, there is an intensive care bed available, but delivering it is not easy and is not straightforward at the moment.
Every day the hospital has had to find enough staff to work here. 200 have been redeployed, causing huge disruption elsewhere.
We have had to step down some surgeries, quite a lot of surgery, and some diagnostic testing, and nobody likes doing that. It's really upsetting to have to stand that down in the face of this massive, massive wave of patients. Has been really difficult.
No one here is surprised by the numbers of people dying from COVID. They're seeing so many very sick patients and expect to treat many, many more. Emily Morgan, News at 10 at the Royal Free Hospital in London.